Colon cancer is one of the biggest diseases that affects American men and women, and everyone's looking to prevent colorectal cancer. We know colonoscopy is the most effective method to reduce colorectal cancer, but there are certain parts of the population that have an increased risk of colorectal cancer, and those are individuals that have hereditary colon cancer syndromes. Lynch syndrome is one of them. Familial adenomatous polyposis is another one. And although it's rare, the hereditary colon cancer syndromes account for about 10% of colon cancers in the United States. So we did our research in particular on the use of medications that may decrease the risk of recurrent polyps and presumably decreasing the risk of cancer in a group of individuals that have this very high risk cancer predisposition syndrome called FAP. In adults, the use of chemopreventive agents, in particular the non-steroidal anti-inflammatory medications, have been used and been shown to be effective in reducing or preventing the progression of polyps in individuals with FAP. And in fact, Celecoxib is a medication that got approved by the FDA for the use of polyp regression in adults. Children have this disease, and oftentimes they have numerous polyps by the age of 10 to 12 years old and are subjected to surgery as the management of treatment of polyposis. So we did this study to say we have a drug that's found to be effective in adults. We did a preliminary study that showed it seemed to be effective in 3 months in children with FAP, Celecoxib. And then we took the data that we got from our phase 1 trial and developed this multi-center worldwide trial of the use of Celecoxib in children with FAP between the ages of 10 to 17 years old to see if we could delay the time to polyp progression or the development of cancer. Well, the good news is that no child developed colorectal cancer. Celecoxib decreased the time to progression of disease, and that was basically more than 20 or more polyps that were greater than 2 millimeters in size. And it also delayed the disease progression. Half the children developed the endpoint at twice the period of time than individuals that were in the placebo arm. Other important point is in this 5-year study that the drug seemed to be safe and didn't really have an adverse effect profile, much different than placebo. So what we found from the study is that Celecoxib delayed the time to progression of the polyp burden in children. Half of the children actually developed the endpoint of the disease progression over time, and it was shown to be safe. And the dose is about the equivalent that we found in adults, 400 milligrams twice per day. There are some interesting things. When we looked at the side effects that were reported, abdominal pain was reported more commonly in the Celecoxib group than placebo, almost twice as commonly. But interestingly, when you looked at other sources of pain, joint pain, muscle pain, and respiratory illnesses, the placebo group had a much higher rate of those reports than the Celecoxib group, which I think goes to the anti-inflammatory nature of Celecoxib. And the only other numerically different adverse event was influenza rates that were reported more high in the Celecoxib group than in the placebo group. Yeah, so FAP is a genetic disease, and it affects about 1 in 10,000 individuals. So it doesn't rise or fall in the population. It's truly an autosomal dominantly inherited disease. But there is data that was presented at the ACG meeting in Philadelphia in 2014 that showed the rise of colon cancer in young individuals between the ages of 10 to 49 years old. So there seems to be there's definitely a decrease in colon cancer in the United States in individuals 50 and over. As we've been more aggressive in colorectal cancer screening, individuals have had colonoscopy and polyp removal. But individuals under the age of 50 generally are not recommended to undergo colorectal cancer screening because they account for such a small proportion of individuals with colorectal cancer. But data from this meeting, again, have shown, like previously, that the population that has a rise in colorectal cancer are those younger individuals between the ages of 10 to 49, totally unrelated to FAP. I think the important thing for individuals that are under the age of 50 is that you need to consider other risk factors. So talk to your families about if they had colorectal polyps or cancer. Ethnicity seems to be involved in colorectal cancer, where African Americans oftentimes have younger age of onset, more severe disease, and greater death when adjusted for stage. So African Americans really are recommended and endorsed by the American College of Gastroenterology colon cancer screening guidelines to undergo colonoscopy beginning at the age of 45 rather than the age of 50. But if you have a family member that has had early onset colorectal polyps or cancer, that should be a tip-off that you might be at risk in a high-risk family. And the other thing is, you need to exercise. You need to maintain a normal body mass index. Don't smoke. Don't drink excessively. And follow a American Cancer Society healthy diet, which includes 3 to 5 servings of fruits and vegetables each day. The other important thing is if you have symptoms that could represent colorectal cancer, don't dismiss them. Don't attribute rectal bleeding to hemorrhoids, but certainly see a gastrointestinal professional to discuss your symptoms and undergo the appropriate testing if you have symptoms.